This will soon become a familiar scene for you and your family. A stay in a unit of the VCU Medical Center's critical care hospital can be a life-changing experience. This experience, seeing someone you love critically ill and attached to a lot of technology, may at first be quite a shock. That's understandable. But what you see here are the tools that can sustain life and bring some comfort from pain. And they are being operated by a highly trained and extremely devoted team of nurses, doctors, physical therapists, respiratory therapists, and other healthcare professionals working together to ensure your loved one can be comforted and ultimately healed to the best of his or her potential.
How's that? We actually program, all of the pumps have every medication that we use. And so we go in, we find the exact medication, we put in the concentration that's up here on the bag given to us by pharmacy, and then we're able to run it at a rate that, that the pump kind of guides us with and pharmacy sets.
Each one of these devices is programmed to ensure a critical care patient is given the prescribed amount of medication, nutrition, fluids, and oxygen to ensure stability while healing.
All of the IV drugs are reviewed by pharmacy and the doctors every day as to see if it's something that they need to continue, is it something that we can maybe, as in the case of the blood pressure medication, is it something that we can bring down every day, or is it something that needs to go up based on the patient's presentation? And then the nutrition, again, is reviewed every day, and if the patient is able to eat, then we're able to take this nutrition down and give him some tube feeding or allow him to eat just regularly.
Doctors and nurses can monitor their patients at workstations scattered throughout the floor. Even if a patient is alone for just a few minutes, there is never a moment where their vital signs are unknown.
This is Jennifer, may I help you?
And all nurses carry special phones that work on an internal communication system, so they are never out of reach. Alarms from patients' rooms and call bells ring to this phone. After the visual shock of seeing a patient in critical care, it is also understandable that all the sounds that fill the room or the hallways may be cause for anxiety. Fear not, many of the alarms you hear are only reminders.
When the infusion's finished, it'll just kind of beep once and then it'll continuously beep until you come in here. And if it's something bothersome, the patient or the family member can just call out and ask the nurse, tell the nurse that it's beeping, and one of the nurses can just come in here and fix it.
If you are about to begin the vigil of seeing a loved one through a painstaking illness or devastating injury, understand this: you are never alone. Someone is always there to lend an ear or help you get past any emotional difficulties and help you make good decisions. VCU Medical Center's Critical Care Hospital employs on staff social workers who can guide you through the many decisions you have to make on behalf of your loved one. They can connect you with insurance providers, doctors and nurses, home health professionals, and help you find a place to stay. And for assistance in finding deeper meaning or comfort, the Critical Care Unit has a full-time staff chaplain who will be there to assist in prayer, find strength to move on in a time of great weakness, or simply to listen.